A great thing to do before your total joint surgery is to assess your home entryway, making sure that it's clear of any trip hazards, bringing in a walker that you may have to make sure it fits through doorways and across thresholds with ease, and also making sure that those carpets or mats are going to stay stuck to the floor and not create a tripping hazard.
Helpful to prepare before coming home is your kitchen area. The best way to set everything up, especially if you just had a hip surgery, is in a place where you can reach so that you don't have to bend over. So making sure that all of your glasses that you're using very often or dishes are on the first couple of rows if you can. Some people will even choose to set things up on the countertop in a basket or a dish strainer so that they can reach everything pretty easily without having to bend. The same goes for anything that might be underneath the sink or in lower drawers. Things that you know you're going to need over the next month or two, just go ahead and move them up to an upper drawer for now. If there are some places where you know for sure you're not going to be able to get to them, but they need to stay where they are, such as in a low freezer, just make sure you're planning ahead for when family or friends come to visit that they can move things up for you when they are here. Another thing to keep in mind as you're moving around with your walker is, especially if you had a hip surgery, you have to be very mindful of what your doctor's precautions are. So if you are told not to twist at the hip, and you need to get something out of this drawer over here, making sure that you're doing the appropriate turn with the walker. Nice slow turns, and then you can go forward and get what you need out. Same goes for washing dishes or moving things along the counter. Just do very slow side steps with your walker and then follow along with your feet to put things where they need to go. It's important to consider where you're going to be spending most of your time when you come home. For example, I have a nice sitting area set up here with a recliner chair, a table. I've got my remote control, phone, book, some water. Those are all nice things to have on hand so that you don't have to make trips around your house without needing to grab things that you hadn't thought of. So when you go to sit down, you want to make sure that you have a nice wide open pathway to get to your chair, and then back completely up to the chair with your walker. And make sure you're following all the guidelines that your therapist told you about. Make sure that you reach back for the chair and sit down, and then you can scoot back and get comfortable as you need to. I prefer having this folded up blanket here, or you can use a pillow or any kind of cushion that makes it a little higher if you're tall like I am. Make sure that you can get through all of your doorways. You want to make sure you can get into your bedroom and bathroom as well. If you get up to your doorway and you find that it's just not going to fit, one quick fix is that you can switch the wheels from your walker from facing outwards until they're facing inwards. And it's very easy to do that. All you need to do is to turn your walker upside down, and there are some pins that are inside the walker leg, and those are the pins that help you adjust the height of the walker. All you do is push the pin in and pull each one off, and then simply place it on the other side. To push it back in, you push the pin inward and turn it slightly so that it doesn't pop out right away. Make sure you get it all the way to the point where you want it to go, and then you can do the other one. There. And now you have the walker wheels on the inside of the walker, just like that. So now when I try to go through the doorway, it fits just fine. So when you get home, you want to make sure that you're looking inside your bathroom as well. For some people, if they have a lower toilet, they may need to look at some different options for making it a little bit higher or making it easier for you to get up and down. You may want to think about either installing a grab bar, or if you have a countertop next to your toilet, that might work out for you. Just try it before surgery and make sure you feel like you can do that without breaking any of your precautions your doctor will give you. If you have a walk-in shower, that would probably work best for you. If you do end up finding a seat, you want to make sure that it fits and that it's adjusted to the proper height for you and that you can get on and off of it easily without going down too low. Most shower chairs are made with built-in pegs so that you can adjust the height of the seat as well. For those of you that only have a tub shower combo, it's pretty difficult to get in and out of your shower, especially those first few weeks, without breaking your precautions or having a pretty good increase in your pain. At some point, to be able to step in and out, you do have to put all of your weight on your surgery leg, and that's pretty uncomfortable for a while. A good option, even for a short-term solution, is a tub transfer bench. And this is a bench that fits outside your tub and it extends over the inside of your tub so that you can sit down on it and slide in. All you need to do is just back up to it, reach back and have a seat, and then you can start working your way in, bringing your legs in. Now you can see in this shower, I'm not facing my shower head or the water. For a lot of people, if your water was over here and you had a 90-degree hip precaution, this would be too much. We also have the toilet in the way, so if I were facing my shower head, I wouldn't be able to swing my legs in. In this case, your best bet might be to have a handheld shower head that you could have down here and then rinse yourself with. Then when you're getting out, simply lift your legs up and over. And from here you can dry off and stand up and you're all finished. So if you're curious about grab bars, one of our biggest recommendations is a pretty simple test. Simply try to get into your tub and find where you tend to hold your hands, looking at the height of them and making sure that they're in a comfortable place. And that's the best place to put a grab bar. Also take into consideration if you're planning on sitting on a chair at any point, it may be best to make sure that you can reach it from a sitting position as well. But the best place would be someplace inside the tub if you're needing the assistance for your balance while you're actually showering. And then having a bar just outside the tub, someplace secure that you can reach from inside, helps quite a bit with getting in and out. Most therapists will tell you that they don't like throw rugs, and as far as I'm concerned, you're okay to have the ones that you absolutely have to have, as long as they have a good rubber backing to them and they're not going to move around on the floor. But you definitely don't want to try to stand up on a wet floor without some kind of support so that you don't slip.